What we really want to do is put a significant amount of shear in the SI joint in the sagittal plane. But what we don't want to do is do anything to the low back. So, very first step, go ahead and pull this knee up, pull it in, keep it like that. Very first step is to pull the knee in towards your chest like this. And this does what to the low back? Doctor words.
Decreases the lumbar curve.
Flexes it. So we're flexing the low back, which will decrease the lumbar curve. And that will keep it safe. Because the next step is to let the leg hyperextend off the side of the table. And if the low back's not stable, then you'll just hyperextend your low back. So, patients like this, I'm eventually going to help the patient keep that leg as flexed as possible, or that hip as flexed as possible, to maintain that lumbar flexion. So now scoot towards me. You need to get this leg off the table and the hip off the table a little bit. So keep scooting a little bit. There we go, perfect. So now the SI joint's a little bit off the table. So you want to get the PSIS as close to the edge of the table as possible. I'm helping her maintain this lumbar flexion. And then I'm allowing Michelle's leg to drop until it stops on its own, keeping this leg in flexion. Her foot's not on the floor, so I'm going to push through. Same thing, oscillate at the end there. Bring it back up. If the SI joint, when we're shearing it, is painful, what are we going to notice?
Where is it?
Where would the pain be? Right back here. Good.
So her left glute was off of the table.
A little bit.
A little bit.
Yeah.
Not all the way.
Just about. That's it.
If someone had really long legs and their foot was touching the ground before you could even put pressure on, what would you do?
In my office, I'd raise my table.
Yep.
Here, I don't know.
Okay.
I mean, chances are they're fine if their foot can go all the way on the ground. Because if we're keeping this leg in and flexed, and that's going to flex the pelvis and the lumbar spine, that should give us a little bit of stress in the SI joint. Maybe if somebody has a really long leg and they're on the red table, that wouldn't do it. But on the blue or green table, that's good. The stress in the SI joint at that point. If you allow the low back to extend, you're not going to get any benefits from this test. You're actually doing the test improperly. What if I feel pain in my hip?
Isn't that how you would SI pain?
Well, it is, but not for SI joint pain. What would it be? It's positive for hip pain. Then we got to figure out what that is. We're going to do other tests for the hip. But we have to figure out